This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're starting right where we left off on our last episode and digging deeper into vaccines for a part 2 with Dr. Gregory Poland, a vaccinologist at Mayo Clinic in Rochester, Minnesota. Dr. Poland, let's talk about vaccine choice because there are more choices available now than ever before. For example, how do I choose between a Pfizer COVID vaccine or a Moderna COVID vaccine? Is there a difference between different brands that we hear about?
Very much so. While they're both mRNA vaccines, they differ subtly from one another. They have a slightly different spectrum of side effects. People forget that those aren't the only COVID vaccines available in the U.S. There's one called Novavax, which I tell all my patients about so that they have a choice among 3 different vaccines. Let's take influenza vaccine. When I started in my medical practice, there was one vaccine, a trivalent, inactivated, injectable vaccine. Well, now we have a live attenuated nasal spray. We have standard dose vaccine. We have high dose vaccine for seniors. We have a recombinant cell influenza vaccine for people who have egg allergies, although egg allergies are no longer an issue with influenza vaccines. So we really, again, can choose the right vaccine for the right person. We have 3 different RSV vaccines, even though those are the newest ones approved for use in the U.S. So that's why I would say in that case, you want to ask your physician.
I have kind of a weird question. Is a vaccine ever going to work better for some groups of people than others, or do vaccines generally work equally well for everyone?
You are touching on an area of vaccinology that I have done a number of studies and published papers on. So, an interesting fact is that for every vaccine that I have studied in my laboratory, every viral vaccine, healthy women always produce better immunity than healthy men.
Wow.
And that's one of the reasons that I think women experience more in the way of local and transient side effects. So for body weight, they're doing a better job at producing immunity than men are. Now, does that mean they're getting too much vaccine? It's a good question. If we gave them slightly lower doses, that's not approved. I'm not recommending that. Would they develop the same level of immunity that men have rather than higher levels of immunity? Unknown, really. But there are definitely gender differences in response to vaccines. My wife, she's very thin. I weigh about double what she does. And yet we get the same dose of a vaccine.
Oh, do you think that the fact that immunity is stronger in vaccinated women than vaccinated men, do you think that is because on average women weigh less than men, or do you think there's something else going on there?
I think that's part of it. I also think that from an immune and creation standpoint, the most important person for the propagation of the species is the woman. She's going to bear this child. She's going to nurture this child. She's going to protect this child. But from an evolutionary point of view, it's key that women have immune responses that will protect them from infectious diseases and their child by passing that immunity through the placenta.
So it makes sense from an evolutionary point of view that women might be more robust under certain circumstances.
Survival of the species.
Yes.
By the way, it's interesting to me that women withstand water, food, and extreme condition deprivation better than men do. And that's been shown over and over again.
Yeah, it's so fascinating.
Probably for the same reason.
Although survivalist shows we hold on to our weight longer than men do, we manage to survive certain things with more strength than men.
Yeah. Now, there's an interesting corollary to that. We inject into the deltoid, the upper part of the arm, but there's a fat pad under that skin that sits above the muscle. Women have a thicker deltoid fat pad than men, so they need a longer needle than men. And we have documented that one of the reasons women may have more local side effects is that they were administered the vaccine with too short of a needle.
Interesting.
So instead of going in the muscle where you don't feel those side effects, it's going more superficially into the fat pad.
Fascinating. Wow. So fascinating. Now, let's talk about the effectiveness of vaccines. So we were all so grateful when the COVID vaccines were finally available. A lot of us immediately signed up, got on the waiting list, got our shots. And yet some people, even with the COVID vaccine, did eventually get COVID. And some people took that as a sign of like,
oh yeah,
did I really need the vaccine? I got COVID anyway. What would you say to those folks?
A couple of things. Number one, it did protect you from infection for a period of time. That's probably in the 4 to 6 month plus time period. The longer term benefit is that you produced T cell immunity, cellular immunity, that protected you against disease. So there's protection against infection and there's protection against disease. That is the complications caused by that. So who develops long COVID? Out of proportion, it's predominantly women who didn't get vaccinated. The more vaccines you got before you got infected, the less likely you developed long COVID. The less likely you had heart complications, the much less likely that you developed a pneumonia that required you to be hospitalized or have a tube put down your throat so that a machine could breathe for you. So there are two different aspects of this. And again, it's a nuance the public doesn't understand. I've heard it for decades. I got the flu vaccine and I got the flu anyway. Well, yes, it protected you against infection, influenza vaccine in particular, imperfectly. But more importantly, you didn't die. You didn't end up in the hospital. You didn't end up with pneumonia. And that's what its real benefit is.
In this day and age, we have more vaccine choices available than ever. They might come in different forms, have differing side effects, or be formulated for specific populations. You can check with your doctor on which vaccine options may work best for you. Vaccines can affect all of us differently. In fact, female bodies produce better immunity than male bodies after vaccination. This could be due to a number of factors: average body weight, evolutionary immune responses, even the location of the injection site. And if you get vaccinated against a certain illness and still get sick, it doesn't mean the vaccine didn't work. In fact, the vaccine could be the very reason you didn't get infected sooner. It may also have made the illness milder than it would have been otherwise. Next, let's hear more about how protective vaccine protection actually is. We've talked about how even when you do get sick after having a vaccine, it still offers you protection from the infection and from disease. But can any vaccine provide 100% protection?
As I said, I believe in absolute transparency. No vaccine, there might be one or two as I think about it, but let me just say it more simply. There is no vaccine that is 100% effective. There is no human-made product that's 100% effective. Many, quote, natural infections are not 100% effective. If you decide not to get the COVID vaccine and run the risks of that infection, you will get infected. And then you'll recover, hopefully, from that infection, and you will get infected again. So, quote, natural infection didn't protect you either.
I'm glad you brought up Natural protection.
There's nothing natural about it, but that's the term people use.
Yes, we hear a lot of folks saying, oh, I'll just go the natural route when it comes to certain protections. When I was a kid growing up, for example, some people would have chicken pox parties like, oh, let's just naturally give all these kids chicken pox. And so you're saying the natural way isn't necessarily the safest way or the healthiest way.
In fact, in almost no case is it safer.
Mm-hmm.
And I liken vaccines to what we do with cars. You know, if you were my spouse, what I would do is I would be sure that the brake worked on your car. I would be sure you had good tires. I would be sure that you wore your seatbelt and that your car had airbags and that you knew how to drive well in different conditions. So what am I doing? I'm layering protections around you.
Mm-hmm.
None of those are a guarantee that you won't have a car accident. But it's saying if you do have a car accident, I have greatly increased the odds that you will survive it, that you won't have a serious complication as a result of that. Same is true by analogy with vaccines. That's what we're trying to do. Layer protections around you.
In a perfect world, we'd all be able to get vaccines, but it turns out not everybody wants to get them. How are we as a country doing when we look at vaccine rates?
This is a very discouraging thing for me as a vaccine expert. For the first time in my career, in my life, and I've sojourned this earth for over 6 decades, we have some of the highest rates of vaccine hesitancy and rejection, some of the highest rates we've ever seen in exemptions from school-based requirements for vaccines. And as a result, let's just take measles. Everybody has heard that term. Measles is the most contagious disease we know of in humans. And when you have immunity drop below about 95% or so, you will have outbreaks again. Measles was eliminated in the U.S. in 2000. Last year, we had something like 60 outbreaks.
Oof.
And it means that children will be harmed, children will die. And I'm sorry to say, at this rate, we will. It's not a matter of if. We will have measles outbreaks again.
Mm-hmm.
That's a very dangerous place to be and live when people don't even have that level of care for one another.
Yeah.
By contrast, I've traveled to several countries in Asia, and particularly during respiratory season, you see routine, and for decades have seen the routine wearing of masks. Stop a young person and ask them why they're wearing that mask. And they'll say something like, to protect my family, my community.
Yeah.
And they have a far more developed moral sense of that than what we see in the U.S.
You talked about measles outbreaks, but I've heard people say, well, why do we even need to get vaccines for measles or polio? We eradicated those, right?
So we didn't eradicate, we eliminated. Those are two different scientific words. So with rare exceptions, you're right. You don't have to get a smallpox vaccine because we eradicated it. There is no circulating smallpox. The problem with something like measles is while you haven't seen a case, there's lots of cases in Africa, in the Middle East, and polio cases. And guess what? Aid workers and non-government organizations and tourists and business people go there, and what happens? They bring it back with them.
Mm-hmm.
And so you, in fact, now are not protected and you are exposed to measles and you'll get it.
What other misconceptions about vaccines have you heard floating around these days?
I think just a tremendous amount of misinformation. You hear celebrities saying that vaccines need to be greened, that they have poisons in them. The ludicrous idea that they have microchips in them controlling people, that they're not effective, that they're dangerous. Here's a common one I heard. Well, I heard that people got the COVID vaccine and dropped dead. Well, if they did, it wasn't from the COVID vaccine. Do you think as a doctor, I would give myself and my kids and my grandchildren and my dear wife those vaccines if I thought they were deadly?
Mm. What did COVID teach us about vaccines?
I think it taught us that introducing a vaccine into this culture is much harder than any of us thought. We thought people would flock to these life-saving vaccines. I think the recognition that our education system has not been very effective in teaching people health literacy. We have to radically rethink that if we're going to have a healthy, productive population. In fact, it's true for all of the developed economies. We are rapidly becoming an older society, an obese society, a diabetic and immunocompromised society. And that's going to have profound ramifications for people's health. I think the currency of the future won't be money. It will be your health and your quality of life.
A vaccine is like a car. It doesn't just have one way to keep you safe, but a lot of different ways. From the seatbelts to the airbags to the brakes. And the same way a car can't prevent an accident, a vaccine can't 100% prevent infection. But it can do its best to keep you from harm and increase your odds of survival. And if you're thinking of going the natural route, taking your kid to a chickenpox party or getting sick and building immunity that way, you should know that that's not recommended and by no means is it safer. Without vaccines, we also risk the return of previously eliminated diseases, like measles, which has in fact come back. Vaccine hesitancy and rejection is at an all-time high. And some of that can be due to misinformation or misunderstanding about vaccines, so be careful about where you get your news and information. Our health literacy is more important than ever, especially as our population becomes older and faces more health challenges. Next, let's hear more about the future of vaccines. Now, Dr. Poland, you're known for coining the term vaccinomics. What does that mean and how can that help people?
Yeah. So vaccinomics is what we call it. And it's the idea that we are whole people. It is holistic. So our gender, hormone levels, medical conditions you have, your genetic makeup, your proteomic makeup, a whole variety of things influence how you respond to a vaccine, all the way from no protective response to a perfect protective response to local transient side effects to significant side effects. And the idea there is, just like we're doing more and more with healthcare and with drugs, that we move away from one dose of one vaccine for everybody to a personalized approach. What are you at risk for? Are you at risk for certain side effects? Do you need 3 doses or do you maybe need 1 or 2 doses based on your genomic makeup? And the whole idea of this field is that in the future, we will be able to increasingly predict that and guide people more in a precision way than we do right now, which is more a public health approach. Get the largest number of people immune as quickly as possible.
I love that vision for the future of vaccines. I love them being individualized because we're all so different. You know, we already mentioned size and gender, but there are so many other ways that we are unique beings. And so it would make sense that there would be so many different ways of addressing each person's vaccine needs.
I spend all of my working time now in vaccines and preventive medicine and longevity. I want to live as healthy as I can for as long as I can, thinking as well as I can, playing and enjoying life as long as I can. And I want that for you. I
Oh,
want that for everybody. I want that for my patients. I'm bivocational. I'm a physician scientist, but I'm also a Presbyterian minister. And I took 2 sets of vows, one the Hippocratic Oath, and the other my ordination vows. And those mandate that I be honest with people, that I endorse a set of morals, and that I care for people to the very best of my ability and try to prevent disease and to guide them as well as I can. And so I will say the other thing that the pandemic taught us, and this was not a good thing, is that it saddened a lot of doctors and nurses, and a surprising number of them have retired and have left the field because they felt unappreciated. Their motives were impugned. They were accused of just ridiculous things, trying to battle the amount of misinformation when, I mean, I can only speak for myself and my colleagues that I know. Our work days are tremendously long, trying to protect people's health, not harm their health. Now, having said that, and again, in the interest of being very, very honest with you, I've had a vaccine side effect from a COVID vaccine. I've published this. I developed chronic ringing in my ears as a result. It has never gone away. Would I take a vaccine again if I went back to the beginning of the pandemic? Absolutely. Because the risks of not getting that vaccine were so much greater. Do I want to educate my patients on the full spectrum of risks and benefits? Absolutely. I want all of us to feel we were educated, we made the best decisions we could with the information we had at the time, and we did the best we could. Now, one other thing about this that people don't understand, and one of my colleagues published this, the editor of JAMA, and I thought it was beautifully written. And they said this: science is iterative and arcs toward the truth. Even influenza, which we've known about for more than 100 years, we still learn things every month about that virus.
wow.
So you will hear people say, well, they don't know. The recommendations keep changing. I think the answer to that is thank God. It means we're learning. It means that we're synthesizing new information. We're getting ever better. And we get better and better over time, and that benefits all of us. But we have to make decisions where we are in a certain place and time that we think are best.
Oh, I love that hopeful note, a very informed note coming from you, Dr. Poland, of where we're headed, what vaccines can do for us, what they've already done for us. Thank you so much. For everybody out there who may want to know more about vaccines or have more questions beyond the ones we've already discussed today, where would you recommend they go for more information?
You know, I think there are a number of resources. First of all, go to the website of any academic medical center. Those are credible sources of information, whether it's my own institution, Mayo Clinic, or other institutions. Don't get it from celebrities and sports stars and people peddling misinformation. You will be misled by that. There are apps, for example. Mayo Clinic has one called the Vaccine Hub, I believe it is, that patients can access and physicians can access so that you can see, am I at risk for this disease? What vaccine should I get? You can go to the CDC and download immunization schedules for children, adults, and based on medical conditions that we use in medical practice. So get good information, make wise, informed decisions, and protect yourself, your precious family, and your community.
Oh, thank you so much, Dr. Poland. I hope that everybody listening today feels inspired to do all of the above, protect themselves, protect their families, protect their communities. We're all counting on each other, and vaccines can be a huge part of that. Thank you so much, Dr. Poland.
Thank you.
With Dr. Poland's idea of vaccinomics, he's working towards a future of individualizing doses of vaccines. Ideally, in the future, the amount of vaccine each person would receive would depend on their own medical conditions, genetic makeup, and hormone levels, helping to limit the side effects they experience. And the whole aim of this field is that in the future, we can increasingly individualize how we administer vaccines too. Maybe one person needs 3 doses and another only needs 1. Ideally, we'll be able to be more precise in how we guide people's health choices and efficiently vaccinate as many people as possible. The science keeps changing when it comes to vaccines, and that's a good thing. It means our scientists are always continuing to learn, allowing our doctors to provide better and better care. Okay, that's all for this episode, but if you've got a question or topic suggestion, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more information on vaccines, check out Mayo Clinic's Vaccine Hub. We'll have more information in the show notes. On the next episode of Health Matters, all about ovarian cancer. What are some symptoms that might be signs that somebody is suffering from cancer in this area?
So they can be kind of a variety of things, and they're not very specific. You might have bloating, you might have some pain in your pelvis or your abdomen, you might have changes in your appetite, you might have changes in your urinary frequency, back pain. And so this is a major reason why patients typically are diagnosed at a later stage in disease, because we typically might dismiss those types of symptoms as just something that we deal with on a normal basis.
And for more Health Matters episodes and resources, head to mayoclinic.org/Health Matters. And if you found this show helpful, please subscribe and make sure to rate and review us on your podcast app. It really helps others find the show. Thanks for listening, and until next time, take care and stay healthy.